So today I am going to talk about teeth bonding. You've heard that term. I went to go get my teeth bonded. I think I want to get my teeth bonded right here. I want to get this gap closed just a little bit. Or my tooth is darkened. Maybe I can get some bonding right there. Those are terms that a lot of people use when they're referring to a cosmetic change with usually their anterior or front teeth. Bonding, however, is a filling. When you're on my side of the chair, it's a filling. So it's just a filling that we term bonding, again, when it's used to change the aesthetic result or the way the teeth look in the front. So let's give some examples about why and when it might be utilized. So if there's decay, which is a primary reason, if there's a fracture, say from trauma. A lot of times I get kids in here who were playing basketball without a mouth guard and they broke half of their front tooth. Usually not both, usually just one. And another option would be to close a very small space in between the teeth. Another option might be to change the shade, usually to brighten the tooth surface. So all of those are reasons why someone might want to get bonding. And the procedure is chair side. You experience the same thing you would experience when you get a regular filling any other place in the mouth. We select a shade, you're anesthetized, you have the procedure, and we collaborate in terms of the final results, in terms of whether or not it meets your needs as well as ours. Because it's an aesthetic area in terms of the front of your mouth, we want to be on the same page and make sure that we get the best result that we can get. So that's just an hour most of the time, depending on where the tooth is, how many teeth we're doing. But simple procedure, regular chair side filling. So your next question might be about how much does this cost? Well, it depends on how many teeth we're bonding, how many surfaces on that tooth, and that cost would also vary based on whether or not insurance would be involved. So to give you an average or a range, probably $200 to $300 per tooth. So another question you might be asking is, how long will this filling last or bonding last? So let's use the example of someone who fractures or breaks their front tooth during a sports activity. So when we replace that missing tooth structure in the front of the mouth, we usually have to add a lot of the bonding material or filling material to the natural tooth structure. So when you've got a lot of filling material, you're going to have to be careful with that. We like to say sometimes it's for show. You can still function with it, but you're cutting up apples from now on. You're not biting them with your front teeth. You're not doing a lot of hard biting with your front teeth. They are still functional, but again, this is not natural tooth structure. So it's durable and functional and aesthetic, but not as hard. So if you care for it and clean it and come for regular visits so that we can evaluate if there's any changes or breakdown in the material, that filling could last you easy 7 to 10 years. But it's not unusual for a filling like that to be replaced, especially if it's covering a large portion of the tooth. So now consider yourself fully informed on tooth bonding. Looking forward to seeing you next time. This is Dr. Kelly Dennis in Atlanta, Georgia at Peach Valley Dental.